Welcome to my channel, Body Talk. Heart palpitations. Palpitations may feel like flip-flopping, thumping, or an irregular heartbeat. Anxiety is the main cause of them. Pregnancy, coffee, alcohol, and spicy foods are additional factors. Heart palpitations are normal and typically harmless. Summary heart palpitations. What are they? The sensation that your heart is racing, hammering, or missing heartbeats is known as heart palpitations. Your neck, throat, or chest may be palpating, even when you're sleeping or engaging in everyday tasks. Palpitations might occur at any time. Palpitations are typically not dangerous or serious, despite the fact that they might be frightening. They may, nevertheless, occasionally be connected to an irregular cardiac rhythm that requires medical care. Who is impacted? Heart palpitations can happen to anyone. However, they are more prevalent among women. Heart palpitations can occur at various points in a person's life. For instance, you may develop them throughout adolescence, pregnancy, or menopause. What is the frequency of heart palpitations? Palpitations of the heart are common. One study indicated that 16% of participants saw their primary care provider because they suffered palpitations. Additionally, one of the most frequent causes of cardiologist visits is heart palpitations. Causes and symptoms? What signs of heart palpitations are present? Symptoms of heart palpitations can include the following: racing, banging, not a beat, possessing an additional beat, changing positions, fluttering your neck or throat, as well as your chest may experience heart palpitations. An irregular heartbeat is more likely to be the cause of palpitations if you have heart condition. Important heart disease risk factors. An irregular cardiac valve. What is the duration of heart palpitations? Usually, heart palpitations pass quickly. Though they can last longer, they typically endure a few seconds or minutes. Why do people get heart palpitations? Heart palpitations can be caused by a wide range of factors, including, but not restricted to, feelings, such as tension, worry, panic, and terror. Workout. Being pregnant. Coffee. An overactive thyroid. Low potassium, sugar, or oxygen levels. A low blood carbon dioxide level. A fever. Anemia. Dehydration. Loss of blood. Drugs like asthma inhalers. Beta blockers used to treat heart disease or high blood pressure. Thyroid medications. And antiarrhythmic medications. A few cold and cough medications, such as decongestants. A few dietary and herbal supplements, the use of cocaine and amphetamines, speed for recreational purposes, nicotine. Alcohol. When do palpitations occur in people? Heart palpitations can occur at various points throughout your life. Some individuals encounter heart palpitations accompanied by worry. Your body's response to anxiety or panic can include heart palpitations. Palpitations in the heart after eating. Palpitations can be brought on by spicy or rich foods, as well as by alcohol or caffeinated beverages. Nighttime heart palpitations? These are similar to palpitations during the day. But since you're not as busy or preoccupied at night, you might notice them more. Palpitations in the heart when you're lying down. Palpitations may result from sleeping on your side, since it raises blood pressure. All-day heart palpitations. If you're getting heart palpitations all day, consult with your healthcare practitioner. The majority of heart palpitations pass quickly. During pregnancy, heart palpitations may occur. In order to sustain your unborn child, your heart rate and blood flow both rise throughout pregnancy. Pregnant women frequently experience heart palpitations, which are mostly benign. To find out which medications are safe to use while pregnant, consult your healthcare physician. Testing and diagnosis. How can palpitations of the heart be diagnosed? A medical professional will listen to your lungs and heart. They will also look over your health history, signs, nutrition, the herbal items and medications you use. Telling a healthcare professional about your heart palpitations, including when and how frequently they occur, is beneficial. Their lifespan, your emotions when they occur, your actions when they begin. What improves your mood? During your visit with the provider, you might not experience palpitations. To mimic the rhythm of your palpitations, they might ask you to tap your fingers. In order to diagnose heart palpitations, what tests will be performed? Blood tests are among the tests that a clinician may request. Tests for urine P, EKG, or electrocardiogram, a stress test. Echocardiogram, ultrasound of the heart, a Holter monitor that records the activity of your heart and is worn for a day or more. Research on electrophysiology, catheterization of the heart. A visit to an electrophysiologist might be necessary. This provider focuses on irregular cardiac rhythms. Handling and therapy. How can palpitations of the heart be treated? The cause of your heart palpitations will determine the best course of action for you. You might not require medical attention. You might require medicine, surgery, a treatment, or a device to address heart disease or an irregular heart rhythm. Maintaining all follow-up meetings with your provider is crucial. How can I prevent palpitations in my heart? Calming practices like yoga, meditation, or a breathing-focused mindfulness exercise may help you manage your heart palpitations if they are brought on by stress or anxiety. Additionally, if caffeine causes palpitations, you should limit your intake of coffee and other caffeinated beverages. Will palpitations in the heart stop? If you eat, drink, or do anything that causes heart palpitations, such as smoking, they usually go away without medical intervention. Consuming alcoholic beverages. Consuming beverages that contain caffeine. Consuming rich or spicy foods. Excessive exercise, however, you might require medicine, surgery, a treatment, or a gadget to address the problem if you have heart disease or an irregular heart rhythm. Remember to keep all of your follow-up visits with your provider. Prognosis and outlook. If I experience heart palpitations, what should I anticipate? Generally speaking, heart palpitations are not reason for alarm. Those who possess them are free to lead their regular lives. Are palpitations of the heart harmful? No. Palpitations in the heart are usually not harmful. Are palpitations in the heart normal? Usually a typical reaction to stress or anxiety. Heart palpitations are extremely prevalent. Avoidance. How may palpitations of the heart be avoided? These suggestions can help you experience heart palpitations less frequently. Depending on what's causing them, use yoga, Tai Chi guided imagery, biofeedback techniques, deep breathing, and/or relaxation exercises to lower your stress level. Steer clear of or consume alcohol in moderation. Limit or stay away from caffeine in your diet. Avoid using goods that include nicotine or tobacco. Engage in regular exercise. Find out from your doctor which fitness regimens are best for you before you begin. Steer clear of activities and foods that cause palpitations. Manage your cholesterol and blood pressure. If you enjoyed this video, please like and subscribe to my channel, Body Talk, for more health tips. Thanks for watching. See you soon.